Welcome to the We Level Up Treatment Center video series. In today's video we will discuss Toradol versus Tramadol. Toradol, ketorolac, and Tramadol, generic Ultram, are FDA-approved prescription pain medications. Toradol, an NSAID, eases pain and reduces inflammation by possibly blocking prostaglandin production, which is responsible for pain and swelling. Tramadol, a DEA Schedule IV opioid analgesic, acts by binding to opioid receptors and inhibiting norepinephrine and serotonin reuptake to alleviate pain. Despite both being pain relievers, Toradol and Tramadol differ significantly. What is Toradol? Toradol contains ketorolac, classified as a nonsteroidal anti-inflammatory drug, NSAID. FDA-Approved Uses. Short-term management of moderately severe acute pain requires strong pain management akin to opioids. Post-surgical pain control. Administration. Initially administered via intravenous, IV, or intramuscular, IM, injection. It can be continued orally thereafter. Risks and duration. Associated risks limit its use to a maximum of 5 days. Approved for adults aged 18 and above. Off-label uses. Off-label use occurs for moderate to severe pain in children, pain from metastatic bone cancer, emergency room treatment for acute migraines. Common side effects. Possible side effects include nausea, stomach pain, indigestion, and headaches. What is Tramadol? Tramadol is a type of medicine regulated by the DEA. It's considered a Schedule IV controlled substance, which means it has medical uses but can also be misused or cause addiction. This drug used to be unscheduled but was later classified as a Schedule IV drug due to its potential for abuse. While it's seen as safer and less addictive than some other pain-relieving drugs, there's limited research backing this claim. Doctors commonly prescribe Tramadol in the United States, especially after surgeries, for acute pain relief. About 75% of over 500,000 patients receive Tramadol as part of their post-surgery treatment. Unfortunately, in 2020, around 1.7 million people, approximately 0.5% of individuals aged 12 or older, misused prescription Tramadol products. Tramadol works differently compared to other opioids. It not only affects opioid receptors but also impacts the reuptake of certain chemicals like norepinephrine and serotonin, which can enhance its ability to manage pain. What are the main differences between Toradol versus Tramadol? Drug class. Toradol is an NSAID, while Tramadol is an opioid analgesic. Administration. Toradol comes in various forms, including injections and tablets, whereas Tramadol is primarily in tablet form. Uses. Toradol is typically used for short-term pain relief after surgery, while Tramadol is used for moderate to moderately severe pain for a varied duration. Duration. Toradol is generally limited to a maximum of 5 days of treatment, while Tramadol can be used for short-term or longer durations based on the prescriber's advice. Age restrictions. Both medications are typically advised for individuals aged 17 and older. Which one is more effective? A comparative study in India evaluated Toradol against Tramadol in managing post-operative pain after maxillofacial surgery among 50 adults. Both medications were administered intramuscularly, IM. While both drugs significantly reduced pain, Tramadol exhibited superior pain control compared to Toradol at every hour and was better tolerated. In a separate study in Mexico, the efficacy of these drugs for postoperative pain was investigated. This study compared oral Toradol to intramuscular Tramadol and found Toradol to be more effective in providing pain relief. These studies were conducted in countries where Tramadol was administered via intramuscular injection. In the United States, Tramadol is commonly prescribed as an oral tablet for outpatient use, while Toradol, ketorolac, is typically administered intravenously or intramuscularly by healthcare professionals. Subsequently, applying these findings to standard U.S. prescription practices is challenging. Both drugs can be highly effective in pain management, with several variables to consider. When considering Toradol or Tramadol, one should determine the most suitable medication should involve consultation with a healthcare provider, who can evaluate individual medical history, existing conditions, and potential interactions with other medications. Tramadol withdrawal detox. Tramadol detoxification ranges in severity from mild to severe, influenced by the level of usage and medications involved. It's essential to conduct detox under medical supervision due to potential discomfort. Typically, a doctor manages the process by gradually reducing the dose and monitoring symptoms over several weeks. A proper tapering approach usually limits tramadol withdrawal symptoms to 5-7 days. Symptoms persisting beyond a week are termed post-acute withdrawal symptoms, PAWS. PAWS may include anxiety, depression, mood swings, insomnia, reduced appetite, irritability, and concentration difficulties, lasting 18-24 months but diminishing over time. Medical support for managing withdrawal symptoms may involve metoclopramide for nausea and vomiting, loperamide for diarrhea, ibuprofen or acetaminophen for muscle pain, clonidine for anxiety and sweating, Valium for anxiety and insomnia, buprenorphine, Subutex, to alleviate withdrawal symptoms, Suboxone, buprenorphine and naloxone combo, to mitigate withdrawal symptoms and counteract opioid effects. Tramadol addiction treatment. Upon completing detox, individuals may undergo various therapies and treatments as part of an extensive treatment plan. Rehab after detox is crucial for addressing underlying addiction causes. Rehab occurs in different settings. Residential or inpatient rehab. This involves residing on-site throughout treatment, receiving constant care, and participating in diverse therapies. Suited for severe addiction cases or those lacking supportive home environments. Outpatient rehab. Requires traveling to the facility for treatment and returning home afterward. Suitable for individuals with supportive environments and reliable transportation. Ongoing medication maintenance is integral for maintaining sobriety and averting relapse. Medications like methadone, buprenorphine, or naltrexone may be part of this maintenance. Naltrexone, functioning as an opioid antagonist, blocks opioid effects, preventing highs if opioids are used again. Treatment for opioid use disorder encompasses diverse therapies and supports. Counseling addresses addiction-related issues. Behavioral therapies. Cognitive behavioral therapy, CBT, contingency management, CM, or motivational interviewing foster positive behavioral changes. Family therapy repairs relationships affected by addiction. Vocational training assists in employment post-rehab. Case management aids with social services such as securing basic needs and legal aid, allowing individuals to focus on recovery. Aftercare is essential for ongoing recovery. Post-treatment, participating in individual counseling, mindfulness-based relapse prevention, MBRP, attending support groups like Narcotics Anonymous, NA, utilizing recovery apps, or engaging in recovery management checkups with treatment providers are beneficial. Comprehensive treatment should address substance use and associated medical, psychological, social, vocational, and legal issues tailored to individual needs. Why choose We Level Up Treatment Center? At We Level Up Treatment Center, our dedicated team of professionals is committed to guiding you through every step of your recovery journey. We prioritize your well-being and provide a nurturing environment conducive to healing and growth. Take the first step towards recovery today. Contact us to begin your journey to a drug-free life. You don't have to face addiction alone. We are here to help you reclaim control and achieve lasting sobriety. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.